start by washing my hands. I'm going to close the curtain for patient privacy. Hi, my name is Johanna. I'm going to be the nurse practitioner doing your assessment today. How are you?
I'm good, how are you?
Good. We're going to start by going over your vital signs. They were all within defined limits. Also, your BMI, based on the height and weight that we received today, on our BMI chart was a 22, which falls under the healthy category.
Okay.
Can you explain to me a little bit why you're here today?
Yeah, I was playing soccer with some of my friends and I hurt my ankle.
Okay. Can you describe that a little bit more for me?
Yeah, so I twisted my ankle and I fell and I hurt my right ankle and it's been just aching ever since.
Okay. Is there any other way you can describe the pain other than aching?
Yeah, so like when I walk, I get kind of like a shooting pain.
A shooting pain, okay.
But other than that, it's just kind of like an ache constantly.
Okay. On a scale of 0 to 10, how would you rank that pain?
It's like a 6 to a 7.
6 to a 7, okay. Is there anything that makes the pain worse, other than, like you said, walking?
Just like any kind of weight bearing.
Weight bearing, okay.
Kind of to touch.
Okay. And is there anything that makes the pain better that you've tried so far?
Ice or just taking a medication.
Okay. What medications have you tried?
Just Advil.
Just Advil. And how often have you been taking it a day?
Like 2 to 3 times.
2 to 3 times, okay. Do you have any other associated symptoms besides the right ankle pain?
No.
Nope, okay. All right, so now we're going to start the assessment part of our exam, okay? I'm actually going to start by asking you to remember these 3 words, and at the end of the exam, I'm going to re-ask you them. We're going to check your memory, okay? So the 3 words are apple, penny, table.
Okay.
Okay? So now to start our exam, I'm going to have you turn around and face the wall, and I'm going to have you remove your shirt, okay?
Okay.
I'm going to start with your posterior thorax and your lungs. I'm going to start by inspecting the skin. I can see that it's pale, there's no nodules or lesions, and there's no scarring. I'm going to look at the symmetry. It is symmetrical. The AP diameter is 1 to 2, and respiratory-wise, there is no accessory muscle used. There is no retraction of the inner spaces. There's no tripod position. There's no nasal flaring. There's no cyanosis, and there's no tachypnea. Next, what I'm going to do is I'm going to palpate for symmetrical chest expansion. So I'm going to have you take a deep breath for me. And there is no crepitus or tenderness present. I'm next going to do tactile firmness. So I'm going to have you say 99 when I place my hands on your back.
99, 99, 99, 99, 99.
Awesome. Next thing I'm going to do is I'm going to percuss bilaterally. And then I'm going to measure your diaphragmatic excursion. So what I'm going to do is I'm going to start with your left scapula. I'm going to have you do a deep exhale and percuss down. And I'm going to mark. I'm going to go further to the left and percuss down. Can you inhale for me? I'm going to mark again. I'm going to do the same thing on the other side. I'm going to have you exhale. I'm going to mark. And I'm going to have you inhale. I'm going to go further to the right. And I'm going to measure your diaphragmatic excursion bilaterally, which is approximately 4 centimeters. So what I was listening for while I was percussing is I was looking for when it was changing from resonance to dull. Next, what I'm going to do is I'm going to listen to your lung sounds posteriorly. You can just breathe normally for me. So I could hear that bronchial sounds were loud and high-pitched. Your bronchial vesicular were intermediate, and then your vesicular were a soft and low pitch. So next what I'm going to do is I'm going to place my stethoscope on your back, and I'm going to have you say the letter E. I'm checking for egophony, okay?
E, 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 E.
And the letter E could be heard. I'm now going to have you say 99, and I'm going to check bronchophony.
99, 99, 99, 99, 99, 99, 99, 99.
And the more peripherally I got, it became less distinct and then indistinct. So now I can actually have you turn around, okay? I'm going to do the anterior chest. So same thing, I'm going to inspect the skin on the anterior chest. I can see that it's pale. There are no nodules or lesions, not tender, and it is symmetrical. Also, I'm going to palpate for symmetrical chest expansion. Will you take a deep breath for me? Perfect. And there is no crepitus or tenderness present. Next, we're going to check tactile firmness again, but anteriorly. Can you say 99 for me?
99, 99, 99, 99, 99.
Perfect. And now I'm going to auscultate. You can just breathe normally for me. Awesome. Okay, next we're going to move to the heart. So I'm going to inspect your skin. I can see that it looks good. I'm going to also inspect your precordium. I cannot see any heaves or lifts. I'm going to palpate your precordium for any thrills, pulsations. I'm also going to locate your PMI, which is your fifth intercostal space, the midclavicular line. So I'm going to first find your fifth intercostal space, and then your midclavicular line, so it would be about there. Now I'm going to listen to your heart sounds with my diaphragm. Your aortic area, S1 is less than S2. Your pulmonic area, S1 is less than S2. Your Erb's point, S1 is equal to S2. Your tricuspid area, S1 is greater than S2. In your mitral area, S1 is greater than S2. I'm now going to switch it over to the bell of my stethoscope. Your aortic area, S1 is less than S2. Your pulmonic area, S1 is less than S2. Your Erb's point, S1 is equal to S2. Your tricuspid area, S1 is greater than S2. And your mitral area, S1 is greater than S2. So now what I'm going to have you do is I'm going to have you sit up straight. I'm going to have you lean forward a little bit. I'm going to use the diaphragm of my stethoscope, and I'm going to listen to her aortic area. And there's no aortic murmur present. I'm now going to have her turn to her left side. I'm going to go to the bell of my stethoscope, and I'm going to go in the mitral area. And there is no mitral murmur present. I also noted that I could hear S1 and S2, but there was an absence of S3 and S4, and there were no adventitious sounds. Now we're going to move on to our abdomen. I'm going to have you lay on this table with your head up there, okay? So I'm going to start by inspecting the skin and the contour, the symmetry. I can see that it's pale. There's no lesions, nodules. It's also symmetrical. There's no masses or movement. I'm then going to listen for bowel sounds in all four quadrants. The right upper quadrant, the left upper quadrant, the right lower quadrant, in the left lower quadrant. Vowel sounds were active and present in all 4 quadrants. Now I'm going to listen to the aorta. And then the renal arteries. And there are no bruits present. So next what I'm going to do is I'm going to measure the aortic span. I'm going to find both edges of the aorta. And measure the aortic span. Next what I'm going to do is I'm going to start with light palpation. So I'm going to put some pressure in all 4 quadrants of your abdomen. You're going to tell me if you're feeling tenderness, okay?
Okay.
So light palpation, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Now we're going to do deep palpation, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. And now I'm going to try and palpate the liver edge. I'm going to put my right hand across her, my left hand. I'm going to push up with my right hand and inward and upward with my left hand. And I can palpate the liver edge. I'm going to do a very similar process for the spleen. I'm going to place my right hand here, my left hand here. I'm going to push upward with my right hand and inward and upward with my left hand. And try and palpate the spleen, which in this patient is not palpable. Next thing I'm going to do is rebound tenderness in the right lower quadrant. So what I'm going to do is I'm going to push down on your right lower quadrant. When I release, you tell me if you have any tenderness, okay?
Okay.
Any tenderness?
Nope.
Nope. Okay. So now I'm going to do your basosis sign and your obturator sign. Since you're already laying down, we're going to start with your obturator sign. What I'm going to have you do is flex your right knee up, and I'm going to internally rotate it. Do you have any pain in your right lower quadrant?
Nope.
No? Awesome. Now we're going to do the psoasis sign. So I'm going to have you lay on your left side, and I'm going to have you extend your right leg backwards. Do you have any pain in your right lower quadrant?
Nope.
Perfect. So you have a negative obturator and psoasis sign. Next what I'm going to do is I'm going to palpate your inguinal nodes vertically and horizontally. And they are palpable. Next I'm going to start by percussing your liver. Which is about 6 centimeters. I'm going to try palpating your spleen, your stomach, your gas pattern, and your bladder. Okay, I'm going to have you sit up and sit on the bench. I'm going to have you face the wall again, and I'm going to check for CVA tenderness. Okay, so you're going to feel a light tap on your back, and you tell me if you have any pain. Any pain?
Nope.
Awesome, so you can turn towards me again. Now we're going to check your pulses, okay? So I'm going to start with your radial pulses. Your brachial pulses. Your popliteal pulses. Your posterior tibial pulses. And your dorsalis pedis pulses. And they are all 2+ bilaterally. We're now going to do the Allen's test bilaterally. What we're going to do is I'm going to occlude your ulnar and your radial artery. I'm going to have you squeeze your hand. I'm going to let go of your ulnar artery, and we're going to see if your hand turns back to its color, okay? I'm going to start with your right hand. I'm going to occlude both your arteries, and you can pump your hand. Okay? I'm going to let go of your ulnar artery, and it returns back to its color. I'm going to do the same thing with this hand. I'm going to occlude both arteries. I'm going to have you pump your hand again. Okay, I'm going to release release the ulnar artery, and your hand turned back to its natural color. So you have a negative Allen's test. So now I'm going to have you lay on the table for me again with your head up on top. And I'm going to have you do the Booger's test, which is what you do is I'm going to have you elevate your legs to a 45-degree angle for about 45 seconds to a minute, and I'm going to observe the color of your feet, okay? Make sure there's no color changes. You can start. Okay, you were all set. There was no color changes bilaterally. Next thing I'm going to do is I'm going to observe for any varicosities, which there are none. I'm going to palpate for any edema. And do you have any pain in your calves or your legs?
No.
No? Okay. Now what I'm going to do, and I'm going to do the Homan sign. What I'm going to do with your left ankle because your right ankle is injured. So what I'm going to have you do is I'm going to have you extend your leg like you are. I'm going to have you dorsiflex your foot, which is pushing it upwards. And I'm going to palpate your calf. Do you have any tenderness?
Nope.
Nope, or pain? Okay. How about in your right calf without moving your ankle?
Nope.
Oh, perfect. Okay. So you have a negative Homan sign. And you can swing back up. Okay, so now we're going to do your deep tendon reflexes. So I'm going to have you just rest your arms right on your legs. We're going to start with your brachioradialis. And then your biceps. And then your triceps. I'm going to have you put your arm just like that. Perfect. And then your popliteal. Then your Achilles. And I'm going to check your plantar response. So I'm going to have you put your foot up for me. I'm going to check with the end of my, perfect. And you are negative for Babinski. Okay, so now we're going to do upper extremities, okay? I'm going to start by inspecting your hands and your fingers. I can see there's no redness, tenderness, nodules, lesions, and they are symmetrical. So what I'm going to have you do is we're going to do some range of motion of your hands, okay? So I'm going to have you flex your fingers, extend your fingers, hyperextend your fingers. I'm going to have you abduct them, adduct them, then thumb opposition. Perfect. I'm going to have you close your eyes for me, okay? You tell me exactly what finger I'm touching.
My pointer.
Okay?
My pointer.
Perfect. So you could tell that I was touching your index finger bilaterally. Open your eyes. I'm going to have you squeeze my hand. We're going to test your hand grasp. Okay. You are 5 out of 5 strength bilaterally. I'm then going to inspect your wrists. I can see there's no redness, swelling, tenderness, crepitus, and they are symmetrical. I'm going to do range of motion of your wrists, okay? So we're going to flex, extend, hyperextend. We're going to do ulnar deviation, radial deviation, and then rotation. Perfect. We're next going to do elbows. We're going to flex them, we're going to extend them, and we're going to hyperextend them. I'm just going to inspect your elbows. Make sure there's no redness, tenderness, no crepitus, and they're symmetrical. I'm just going to check your strength now, okay? So can you flex your elbows for me? Perfect. And can you extend them? Perfect. You have 5 out of 5 strength in your elbows. I'm going to have you stand up and do your shoulders, okay? I'm going to inspect your shoulders. I can see there's no redness, swelling, crepitus, tenderness. They're symmetrical. I'm going to have you flex. Perfect. I'm going to have you extend, hyperextend. I'm going to do circumduction. Perfect. I'm going to have you abduct, and then adduct, and then against resistance, okay? So abduct, and then adduct. And it's 5 out of 5 strength. So then I'm going to have you do the balance test. So I'm going to have you do is put your arms like this and tell me if you have any tingling in your hands, okay? Perfect. Do you have any tingling? Nope. All right, I'm going to check your Tinel sign. So I'm going to have you, I'm going to tap your median nerve. Any pain? No. Nope. Okay. So you can sit back down. We're going to do your lower extremities. I'm going to inspect your toes. I can see there's no redness, swelling, tenderness, crepitus, and they're symmetrical. I'm going to have you flex your toes, extend, hyperextend them. Perfect. I'm going to have you abduct them and adduct them. Perfect. Now, we're just going to do this with your left ankle, okay? So I'm going to have you flex your left ankle, extend, hyperextend. Perfect. And then rotation, circumduction. Perfect. Now I'm going to have you lay down for me. Like I said, we're just going to do the left ankle because of your injury. I'm going to have you do plantar flexions. I'm going to have you push down, like you push on a gas pedal, and then push up for dorsiflexion. Perfect. You have 5 out of 5 strength on your left ankle. You can sit back up for me. You can actually stand up for me now. And I'm gonna inspect your knee. I can see there's no redness, swelling, nodules, lesions, and they're symmetrical. We're gonna flex our knee, extend our knee, hyperextend our knee. Same thing on the other leg. Flex, extend, hyperextend. I'm gonna have you flex your knee to some resistance. Perfect. Extend against some resistance. Perfect. You're 5 out of 5 strength. Then we're gonna do hips. So what we're gonna do is I'm gonna look at your hips. I can see that they're symmetrical. Also, I'm going to do range of motion of your hips. So what we're going to do is we're going to flex, extend, hyperextend. And we're going to do abduction and then adduction. Perfect. We're going to do that again for resistance. So abduction and then adduction. Perfect. Okay, you can sit back down for me. Okay, so now we're going to do your spine. So you can stand back up and you can turn around. I'm going to look at the curvatures of your spine and your alignment. So I'm inspecting that I can see your cervical region, your thoracic region, and your lumbar region. We're going to do some range of motion now. I'm going to have you flex forward. I can see that there's no scoliosis of the spine. I'm going to have you extend, stand up straight, a little bit back, and then hyperextend all the way back. Perfect. Okay, now I'm going to set your gaze. You can turn around. I'm going to have you walk heel to toe. Perfect. And on the way back, you can walk on your tippy toes. And one more time, you're going to walk on your heels. Perfect. And I'm just going to have you stand over there. We're going to do another test. This one's called the Romberg test. So what you're going to do is you just stand with your feet together, arms by your side, eyes closed for about 20 to 30 seconds, and I will time you. All right, perfect. You're all set with that. I'm going to have you sit down now, okay? So I'm going to test with some light and sharp sensation, okay? This is just to check your sensation. So you're going to close your eyes and you're just going to tell me if you feel something soft or sharp, okay?
Soft, sharp, soft, sharp, soft, sharp, soft, sharp.
Awesome. You can open your eyes for me. And now I'm going to take my tuning fork. So first I'm going to place it on, I'm going to make it vibrate, I'm going to place it on your ulnar prominence, your 5th finger, and your thumb. And do the same thing bilaterally. Okay, I'm do something similar on your feet. I'm going to strike the tuning fork again. I'm going to place it on your great toe and your 5th finger and your great toe and your 5th finger. Awesome. Now we're going to check your cortical sensation. Okay, so I'm going to close your eyes and flip your hands over. I'm going to draw a number or letter in your palm of your hands. You're going to tell me what you feel, okay?
A 7, a 7.
Awesome. Keep those eyes closed for me. I'm going to place an object in your hand. You're going to tell me what you feel.
A coin.
A coin. Awesome. You can open those eyes for me. And now I'm going to check your cerebellar function, okay? So what we're going to do is I'm going to have you repeat me. Perfect. I'm going to have you flip your hands back and forth. Perfect. I'm going to do your finger to my finger and then your nose. Do it a couple times for me. Okay. And I'm going to have you do knee shin, knee to shin. You can do it twice on both legs. Okay. Now I'm just going to ask you a couple questions, okay? And can you tell me your date of birth?
9/23/94.
Awesome. And I told you those 3 words at the beginning of the exam. Do you remember them?
Yep. Apple, penny, table.
Awesome. Next, I'm going to ask you a scenario. So what, you walk on the street and you find an envelope that is stamped and already addressed. What would you do with that envelope?
Mail it.
Mail it. Perfect. Okay. So I'm going to ask you to do another thing, and I'm going to have you count by 3s, up to 5 times, okay? So start with 3.
3, 6, 9, 12, 15.
Okay. Awesome. Well, I'm done with my exam for the day. We're going to get your ankle all taken care of, okay? We're going to get some x-rays of it, and I'll be back in a few minutes, okay?
Okay.
It was so nice to meet you.
Thank you.